Sildenafil or Viagra is not suitable for everyone. In some situations, taking Viagra could be life-threatening. That's why it is important to know when you should avoid taking Viagra. First in the list is allergic reaction. Few people are allergic to sildenafil. If you have a previous allergic experience while taking Viagra, then you should avoid it. In this situation, talk to your doctor for other alternative options. If you are taking nitrate medicines for chest pain, then you should avoid taking Viagra. Taking sildenafil with nitrate medicine can suddenly and severely decrease your blood pressure. You should avoid this medicine in other heart conditions like hypertrophic cardiomyopathy, a history of heart attack, heart valve problem, life-threatening irregular heart rhythm, chronic heart failure, and uncontrolled blood pressure. As we have previously discussed, Viagra dilates our blood vessels. So, if you have a low blood pressure issue, then taking Viagra can suddenly and severely decrease your blood pressure. So, avoid this medicine or talk to your doctor if you have any heart related issues. If you are also taking an alpha blocker medication to treat an enlarged prostate or high blood pressure, your blood pressure may get too low, which can lead to dizziness or fainting. Some other antifungal, antibiotic, and antiviral medications can also interact with sildenafil. So consult your doctor before taking sildenafil if you are already on other medicines. Viagra is contraindicated in people with retinitis pigmentosa because it can cause a sudden decrease in vision or loss of vision in one or both eyes. Now, what is retinitis pigmentosa? Retinitis pigmentosa is a group of rare eye diseases that affect the retina. It is the light sensitive layer of tissue in the back of the eye. Retinitis pigmentosa makes cells in the retina break down slowly over time and can cause vision loss. The active ingredient in Viagra works by increasing blood flow to the penis. But it can also cause increased blood flow to the retina, which can be harmful to the pupil with retinitis pigmentosa. So, if you have this type of eye problem, then talk to your doctor before taking Viagra or any other ED medicines. Next important condition where you should avoid taking Viagra is Peyronie's disease. It is a condition in which a buildup of plaque in the penis causes the shaft to bend or deform during an erection. You may feel pain and tightness. If you have this type of problem, then strictly avoid Viagra. As Viagra works by increasing blood flow to the penis, it can cause further distension of the plaque, which will eventually aggravate the pain. Viagra is contraindicated in individuals with sickle cell anemia because it can cause a sudden and severe drop in blood pressure. This is particularly problematic for people with sickle cell anemia because they already have a higher risk of decreased blood flow, which can cause their red blood cells to become sickle shaped and block the flow of blood to various parts of the body. Taking Viagra can further reduce blood flow, increasing the risk of sickling and leading to potentially serious complications such as pain crisis, organ damage, and stroke. It should be avoided in other conditions like multiple myeloma, leukemia, and hemophilia. So, in conclusion, Viagra is highly effective medicines for erectile dysfunction. But it is important to be aware of its contraindications. Before taking Viagra, it is crucial to discuss your medical history with a healthcare provider and make sure it is safe for you to use. By taking necessary precautions, you can ensure a safe and effective experience with Viagra. So that's all for today. Hope you find this information helpful. Don't forget to like, comment, and share.